Hello, ladies and gentlemen. Pete McDonagh here, Fox News. We have a very important topic today, healthcare. For years, we have known as a private, in my opinion, private healthcare system. There's only two ways to have public healthcare. That was Medicaid, which is for patients over 65 retirement, and then for the impoverished who couldn't really afford it anyway. So here to share with what the big differences Obamacare are making to our everyday lives, in our expenses, in our jobs, in everyday checkups. The man in the big house, the big dog, President Obama. Hello, sir. Welcome to our show today.
Good evening, Mr. McDonagh. President Obama here.
We would love to have you share with us today Obamacare and what are the big changes from the private system we are used to and the healthcare system as we know today.
Yes, of course. So first, would you like me to outline my Obamacare?
I would love that.
Oh, thank you, Mr. McDonagh.
An attractive young man back there.
See yours?
I don't know. It's debatable.
Oh,
Alright.
Oh, okay. Well, so healthcare, in my opinion, was, as you said, more of a private good. I think we can all agree on that in the United States, at least. Before my Obamacare. Now, the healthcare, the Medicare and Medicaid, as you said, paid or insured 65 years or older in retirement, as you said, and the impoverished. But there were gaps, and the gaps were problems. There were problems, much like the single mother I had to grow up with. That was a problem. Now, the first thing Obamacare took care of was it filled the gaps. These gaps that were growing and growing. These gaps were the people whose employers did not insure them. Now, most employers were honest and very insured all of their employees, but these gaps were caused by those employers that did not insure their employees. Now, the second gap was to reduce the cost of healthcare by changing the way healthcare is provided, which was very much modeled after the European healthcare plan. Now, would you like to mention anything else? Ask any more questions before?
And private healthcare providers, such as UPS, they put you underneath a plan as called Aetna. Would you run those private medical industries out of business, or will they stay in business and people can still keep their private healthcare without moving to Obamacare?
That's a good question, and the answer is yes. The Obamacare isn't for everybody. Medicare and Medicaid do take care of the impoverished and of the retired people. Now, the real hope of Obamacare was that we could drive the rising prices of those two systems down. And I think that's what we did a very fine job of. I was very impressed by that. Would you like to discuss my trip to Sweden next or anything?
It's very true. Sweden has been a public healthcare system for years now. And there's many differences in everyday expenses in health facts between our two countries. And we're wondering if maybe we'll sway that way or not. We'll see what happens. There's many benefits and downfalls, as you will see, though. In the U.S., GDP, 18% goes to healthcare. When compared to Sweden, only 10% does. That is a lot more money going their way. Another big thing between U.S. and Sweden is these are per 1,000 people. The U.S. only has 2.4 are doctors, compared to Sweden, which is 3.7, which means a lot more doctors available per person in Sweden. The average day spent in a hospital when visited is 5.4 in the U.S. and 4.5 in Sweden. That could be a negative downfall to Obamacare, considering you will have less supervision during your hospital stay, and they will not be as positive when leaving. But it will lower the price. The average price per discharge as well between U.S. and Sweden is quite a big difference as well. It's $18,142 per person per discharge when leaving a U.S. hospital, compared to Sweden, which is only $9,870. That's half as much. That is a lot more money going in your pockets. You might be saying, though, where does this money come from? How does Sweden have so much more money to play with, and how come the same care, less money is coming out of their pockets?
Well, that's because I'm not taxing the United States as much. Could be taxing them more.
That's very true. Sweden, the average tax rate for every citizen, the poorest to the richest, 57% of their annual income is gone due to taxes. Compared to the average in the U.S. is 35%.
Very true.
Diabetes as well. The mortality rate from there from 5 to 40 is 32.9% of people, compared to only 5.7% in Sweden. Is there any big differences in health reasons? And I looked into that as well. Obesity, U.S. is smoking Sweden. 33.8% of U.S. citizens.
We have to win in some
obese.
categories.
And then Sweden, that's only 11.2%. But tobacco use is just about the same, with U.S. being 16.1% and 14.3% in Sweden. There's not much difference there.
The way Sweden and the United States are set up, they cannot be answered. Our healthcare cannot become Sweden's healthcare because of our size, our expenditure. We spend much more on stuff than they do. They have a spending cap in Sweden. What is it? $2,200 per person. If a person maxes out, then they will have to pay for it themselves. That's not true. There is no easy way to compare the United States with Sweden, but we can start with the non-profit versus for-profit organizations. There are way too many for-profit organizations in the United States. Those in Sweden who become doctors are doctors because they want to, not, we're going to make a lot more cash by being doctors, which is what the United States is. The United States doctors can bolster their individual income because of the fee per service instead of being on salary employees. And that is the big difference. And Obamacare can only do so much.
There's two sides you can take from our evidence analysis we have received so far today. There is the Obamacare side, which the big difference will be there is the U.S. will lower all health services. Assuming everything goes right, usual health services will go down, such as MRIs, colonoscopies, and hip replacements. In other foreign countries, they are as low as 400% less than what we charge in the U.S. Prices are more consistent, though, also over the U.S. In Sweden, all hospitals are non-profit organizations, which allows them having the same price across the board, nothing really changing across. As in the U.S., for just as hip replacements, say. In Baltimore, they range from $1,600. When you go to Austin, Texas, they can go to $7,500. To New York, which is $8,200. Those are all absurd differences from just certain small areas across the board. Obamacare will hopefully level that down and make healthcare less of a private good and profitable thing to a non-profit organization such as Obamacare is supposed to be. But with Obamacare, taxes will go up. In Sweden, like I said, the average tax rate is 57%. That is absurd compared to the U.S. 35%. If you want our healthcare system to lean towards the way of Sweden, we will have to raise our taxes significantly to have the same outcomes, or assuming will be possible to have the same outcomes as Sweden. Well, thank you for coming today, President Obama. I really appreciate your presence. Thank you, sir.
Mr. McDonagh, it's been an honor.
President Obama, guys. Vice President of the United States.
Obama 2016? 26 Obama 2016.
Yeah, you can't get reelected, so see you later.
Between
Obamacare and our own way the U.S. has been running, which is private healthcare system, there is two ways to go. But the facts, they don't have a certain point or direction like I stated. There's no correct answer or right answer. It's just what you personally would prefer as a person. The few facts that from Forbes magazine was $929 billion is Congressional Budget Office for healthcare from 2013 to 2019, which is absurd. 46 extra $billion will have to come out of hardworking Americans' pockets to pay for Obamacare and other incentives. $500 billion in cuts in the medical program, which will lower our healthcare costs, the big GDP number. But the thing is, that will cut jobs, and the unemployment rate has been over 7% for over years now. That will not help what America needs today. My personal opinion would the healthcare system should stay the same as it is in the U.S. today. I think it would help the U.S. in the long run.